He thought a drink a day was safe until this happened. Hi, welcome to another episode of Patient Case Files with Dr. Happiness, a series in the Health and Wellness with Dr. Happiness channel. Today's patient is a 48-year-old businessman, successful businessman, who started taking beer or alcohol in his early 20s and later progressed to taking stronger drinks and spirits as he got successful. He said drinking was safe for him because he never got drunk. He came complaining of yellowness of the eyes, yellowness of his skin, swelling of the ankles, tiredness, and bleeding from the nose and mouth occasionally with abdominal discomfort. 3 years prior to presentation, his wife had complained that he's losing weight, but he dismissed it, saying that it's stress. He was losing weight in spite of eating well. However, along the line, few months down the line, he started experiencing nausea in the mornings, and in the evenings, he experiences extreme tiredness and weakness. So he complained to his friends, who advised him to take herbal bitters and energy drinks. So he complied. He was taking herbal bitters and energy drinks along with the alcohol, which he takes on a regular basis. He never got drunk. However, he started noticing that his tummy was beginning to swell and beginning to pain him, and his urine color was yellow. He was getting very tired. He started bleeding from the nose, and that was what brought him to the hospital. In the hospital, we examined him. We saw that he was jaundiced. His ankles were swollen. The abdomen was swollen. He had ascites. He has fluid in his abdomen. He had what is called spider nevi, like marks, like spider marks on the tummy. So what did we do? We placed him on admission and then started investigations. Blood was collected for liver function tests, full blood count, platelet counts, prothrombin time. He was sent for abdominal scan and urine analysis. These results came out, and we saw that his liver function test was grossly deranged. It was very abnormal. The prothrombin time was high, and the platelet count low. These are signs of liver damage. The urine showed high levels of bilirubin, and the abdominal ultrasound showed that the liver was shrunken. It was cirrhotic. It was like fiber. What does it mean? This patient was diagnosed with liver cirrhosis with portal hypertension. So he has liver cirrhosis with portal hypertension. Cirrhosis of the liver means when the liver becomes fibrous. And portal hypertension is hypertension that involves the portal vein, the vein that carries digested food that passes through the blood into the liver, because the liver is the engine room of the body. Every food that passes through the digestive system must get to the liver through the portal vein. And so because the liver is shrunken and tough, it's also squeezing on that vein that brings blood to it. And so blood doesn't flow well, and it pulls up. The vein becomes tough. And that is why that's hypertension. And backflow of blood will cause the bleeding. That's why he's bleeding from the stomach, from the mouth. even the nose. And he's bleeding, he's losing blood, he's losing weight. Because the liver is sick, is damaged. All those enzymes and other factors that are produced in the liver are affected. Hence, the bleeding. The liver is the largest organ in the body. Damage to the liver doesn't show up until it has advanced. And so by the time you start seeing symptoms from liver damage, the damage has become very, very advanced. And so for this our patient, that's what has happened. And at this stage, there is really nothing that can be done for him except liver transplant. But do we have places they do liver transplant here? Even though our patient is a successful businessman, can he afford liver transplant? So at this stage, we are left with managing his complications. And so that was what we did. We tried to manage his complications, manage him symptomatically, at least to prolong his life. He got better and was discharged with dietary advice and lifestyle changes. He never touched alcohol again, but then it was too late. 2 years later, our patient passed from massive bleeding from the gastrointestinal tract. Lessons to be learned. The liver can accommodate damage for a long time until the damage becomes severe and unbearable. There is no safe level of alcohol. Alcohol damages the liver and even other organs. Combining alcohol with herbal bitters and caffeine contained in energy drinks will accelerate the liver damage. Lifestyle changes and health checks will help you to detect any insult to any of your organs or body on time so that you can take measures to take care of them. So take care of your liver, take care of your health. If you found value in this video, please like, subscribe, and share this video with people you love. You never know who this may save his life. And please put your comments in the comment section of any topic you want me to bring up. Or if you have any questions, put them in the comment section. Remember, let's together build healthier and happier families. I am Dr. Happiness.